Hello, hello, and welcome back. We are on our 12th day of the nursing school mindset edit. So, yay, you guys, we're not quite halfway. We have 35 days of this, which is super exciting. So today is going to be a quick one because I have to go to work at the hospital, but I wanted to just tell you some things that I have found if students review these key anatomy and physiology concepts, they have a little easier time applying them to nursing school concepts, pathophysiology, the nursing care of patients because it's fresh in your mind, okay? So as long as you are not driving, hopefully you're not watching a video while you're driving, then get out a pen and paper and jot these down, okay? And let me know in the comments where you are listening from and who is here so I can see your faces. Okay, so probably the biggest thing, if you look at nothing else, you guys, and I don't want you making this your life's work before school starts. I'm not talking about learning this stuff again from start to finish. I'm talking about a simple review, okay? So if you still have your notes, just go back and read through your notes. If you're in my boot camp, go back and review that module, which I believe is module 6, where we review a lot of this stuff. Okay, that's it. I'm not asking you to take anatomy and physiology again over the summer, okay? I see a bunch of faces popping up. Sheena is going over blood flow through the heart. That's a perfect one. We'll talk about that in a bit. Sally's in Angwin. Napa is my favorite place in the whole wide world. I love going to Napa Valley. I was just there for my birthday a few weeks back. Epic trip, absolutely. Ashley is in Elk Grove. She's a neighbor. Hi, Ashley. I'm about maybe 30 miles, 35 miles away from there. And are you at PUC? I don't know what PUC is, Ashley. And then, we got someone from Texas. And Stormy's here as well. Okay, hi, everybody. Okay, so the main concept, if you have time for nothing else, the one that's probably going to give you the biggest return on your investment is to review fluids, fluid compartments, fluid shifts, capillary bed pressure, oncotic pressure, all of that stuff, those pressure gradients, osmolality, tonicity, all that stuff about fluids. I use this concept every single day that I am working, okay? So if you do nothing else, really review fluids pretty well, okay? All right, and then that would be the main one because that is going to come into play so very much, especially when your patient is having low blood pressure issues. A lot of the time it's because of the way the fluids are in the body. Maybe they're third spacing, maybe they're fluid volume depleted, maybe they're fluid volume overloaded, and now you've got hypertension and pulmonary congestion. So it really does play into a lot of different things. So if you have time for nothing else, that's the money one, okay? Do that one. I would also go and look at cardiovascular physiology. Review that blood flow pathway through the heart, lungs, like where it comes from, where it goes. Review that. Review the determinants of blood pressure, like cardiac output, peripheral resistance, heart rate, stroke volume, all of those things. Okay, you guys learned that in A&P. Go back, be solid on that, okay? Those would be the top 2 things to review. You're going to use both of those concepts probably every single time you are in clinical and definitely every single time you're working as a nurse, especially if you're working with sicker patients, okay? All right. And then I would say gas exchange would be another one to just review. I'm not saying memorize that. What was that equation that we had to learn for anatomy and physiology? Don't memorize that. You're never going to do that equation, but just understand the concepts behind gas exchange, okay? O2, CO2, how, hypoventilation is going to cause increased CO2, hyperventilation is going to blow off CO2, things like that. understand the difference between oxygenation and ventilation, okay? Definitely really come in handy with your respiratory patients who have respiratory disorders, okay? And then the renal system and renal physiology, really handy. And when you look at the renal system and you've looked at the respiratory and kind of that gas exchange thing, that's going to also tie into acid-base balance. So kind of all of those things together, okay? So the renal system, renal physiology, filtration, the absorption of electrolytes. You don't have to memorize all that they are, but just know like there's fluid reabsorption, there's electrolyte exchanges, all of those things. Because in pharmacology, you're going to be giving medications that affect that. And then you have to watch for things like hypokalemia, right? So understanding that renal physiology. And then electrolytes would be another one. Don't stress too hard. Mostly what I see students stressing about with electrolytes is trying to remember the numbers. And understanding electrolytes, the numbers is like 5% of what you need to know, but students spend like 95% of their time memorizing those numbers. It's much more valuable to understand why you even care about that electrolyte. What does it do in the body? So go back and review that. Yes, we do go over that in boot camp as well. And then endocrine would be another one. I know the endocrine system is really complex, and it was one of the harder subjects for me in anatomy and physiology, just because there's so many of those chemical messengers and those chemical pathways, right? The main things about endocrine is get solid on how feedback loops work, okay? Especially the negative feedback loop. You're going to see that so much more often than a positive feedback loop. So refresh on negative feedback loops. A great one to review for that concept is the TSH, you know, how TSH will be high when the thyroid hormone is low, right? So it's a negative feedback loop. So review that. Maybe also look at, well, aldosterone does, antidiuretic hormone. I would say the thyroid ones, those are kind of the main ones, right? Norepinephrine would be another one, epinephrine, those catecholamine type things. Dimensional analysis, we talked about this. Was it yesterday or the day, or maybe it's coming up? I'm trying to remember. Did we talk about math anxiety yet? If not, we will be. Math anxiety, I think we've talked about it. If you can have a reliable system where you're doing the same process with every single kind of dosage calculation question, talk about a load off that anxiety, right? You don't have to be sitting there in your exam trying to remember what formula do I use with this type of question. You just know I've got a systematic way to do it. So review dimensional analysis from your chemistry class. If you didn't learn it, I will link to a quick tutorial on dimensional analysis on the website so that you can get introduced to it, okay? And then the last three, you guys, the Ras pathway, that's the renin, angiotensin, aldosterone pathway. If you know that pathway, you know what happens in that pathway. Taking pharmacology, you'll learn there's several drugs that act upon this pathway. You'll immediately know and understand what this drug does, why we give it, and what to watch out for the most part. So by learning one little simple concept over here, you have broad knowledge to apply to a much bigger bank of information over here. And that's how you maximize your study time and your efficiency. Neurotransmitters would be another one that I would glance at, get a little bit familiar with those, and with that, the autonomic nervous system. Those are the key things, you guys. So I know that's a lot. Again, if you only have time for a couple of things, I would tackle fluids and that cardiovascular physiology, the components of blood pressure, and that blood flow pathway. Those would be the key. The other ones are going to help you, But again, don't make it your life's work. We do go over a lot of this in boot camp. I'm going to link to that so that those of you that aren't in boot camp can go check it out and see if that would be a good thing for you to do. It's a nursing school prep course. It is awesome, and it's on sale right now. Okay, I'm just going to glance at the comments. Teresa says we did talk about math anxiety. Okay, thank you, Teresa. I was like, I either wrote about it recently or talked about it recently. And we did. Okay. All right. And you guys are just chatting with each other over there. Okay. So that's it. That's my quick review. Fluids, cardiovascular physiology, that blood pressure determinants, all those components, gas exchange, oxygenation versus ventilation, renal system, renal physiology, electrolytes, like what they do in the body, that acid base, that buffering system mechanism, which really just kind of correlates really well with that respiratory and that renal review, your feedback loops, dimensional analysis, RAS, neurotransmitters, and autonomic nervous system. So I know that feels like a lot, but again, you're not relearning it, you're just reviewing it, so it's a little bit fresh, okay? All right. Amanda says, boot camp is good review for second year. Oh, good, Amanda. I'm glad that you found it helpful for that. A lot of students ask me if it will be beneficial for them if they've already started their program. And to them, I always say it really just kind of depends on how your program is structured, what you need review in. And then when students come back later, a lot of times they say either they found it super helpful or they started it at the beginning of their program, boot camp, and then redo it in between every semester. So thank you so much for sharing that. And Jennifer just started doses section. Yay! Yeah, so if dimensional analysis is something that makes you nervous or dosage calculations make you nervous and you want to learn a step-by-step system where I basically hold your hand throughout the whole process until you're independent and flying on your own with the complex ones, then you're going to love Module 4 of boot camp. Yep. Okay, you guys, that's what I have for you today. I am going to see you tomorrow, hopefully. And tomorrow we're talking, ooh, this is a good one. We're going to talk about feedback. And feedback is hard for a lot of students to take. So we're going to talk about how to accept feedback with grace and recognize it for what it is. Okay. So I will see you tomorrow at, I have to look at the time, 10 o'clock Pacific, 10 a.m. Pacific, and we'll talk about that. Okay. I will see you guys soon. Bye.